How does your approach shift for a kid with ADHD or sensory needs versus a neurotypical kid who's just anxious about a new grade?
Yeah. So that's kind of two separate things. A kid with sensory needs, depending on what they are, will need kind of some very specific interventions to maybe help their mornings be successful or their back to school be successful. And, if it's, let's say, a kid who has some audio sensitivity, maybe this is a kid who really needs headphones when they walk into the classroom where it's chaotic and loud in the morning. So that's going to kind of depend based on what the kid specifically is dealing with. But for kids who have ADHD going on, I would probably lean more toward having a really specific kind of routine and structure set up in the mornings and lots of little aids set up around the house to help keep them focused and on track and help their executive functioning stay intact when we're trying to get out the door. And that might mean, setting out breakfast the night before so that they already know what their choices are. Or it might mean having a little task list taped to their mirror that says, brush your teeth, get dressed, brush your hair, go put on your shoes. That way they have something that can keep them on track in the morning time. And this is true for kids, honestly, even all the way up through high school. It will look a little different for older kids, but that structure and routine is really important, really, for all kids of all ages that are dealing with AD.